Hello, everyone, and I would like to thank you again for such a great pleasure to be here today and talk about PrEP implementation during the refugee crisis. So during the presentation today, what I would like to focus on is just a slight introduction about the PrEP availability around the European Union. Then I would like to touch the topic of how is it important for people who have been displaced and coming to the European Union is getting PrEP, and is it possible, and if possible, in how. Then as me personally living now in Germany and working precisely with migrant population in the university hospital in Hamburg, I'm working day to day with people who come into us in need of HIV treatment as well as HIV prevention. So I would like to talk a bit about what people, when they come into Germany, as they've been displaced, how is it possible for them and what kind of challenges are waiting for them on the way to get at least information about HIV prevention, as well as how it's possible to get it. So I would like to show you the biggest groups of migrant population coming to Germany, as well as a little bit introduce of how is it even possible in countries they are coming from to get PrEP, and if it's even possible, and obviously some keynotes to go at the end. So let's start about seeing how it's possible to get the PrEP in Europe. We see that the implementation of PrEP is doing really great, with the majority of countries implementing this on a national level. But let's think about who are these people who might potentially not be in need of PrEP, of how they potentially can get the PrEP. Probably this is a people who are medically insured already. I don't know, each country has its own rules for the medical insurance. In Germany, it's obligated to be medical insurance. Doesn't matter if it's private insurance or it's governmental one. So it basically leads us to the fact that the person has to get already some level of income, so they potentially might pay for the insurance. However, if they come in as a migrant, it's a possibility to get the governmental help for a first steps while the person, for example, learning language or looking for a job or studying or whatsoever. But there is not, it takes, for example, if we speak about migrant population, it takes some time till the person coming to Germany up to it's being on a level it can afford and find a job to be medical insured. So I would like to show now the countries, the list of countries. In Europe, there are 3 groups of countries which having, for example, no PrEP reimbursement at all. Here it belongs Austria, Bulgaria, Cyprus, Czech Republic, Greece, Hungary, Italy, Latvia, Lithuania, Malta, Poland, and Romania. The shortest group of countries which has a full PrEP reimburse, it's Denmark, Finland, France, Germany, Ireland, Portugal, Slovenia, and Spain. And there is also countries which have some partial or mixed PrEP reimbursement. Here belongs Belgium, Estonia, Croatia, Slovakia, Sweden, and Netherlands. So we already understand that in case there are some countries which are not covering PrEP at all. So basically people have to pay their own money to get the PrEP, as well they already have to be to know well that they are in need of this prevention, as well they might potentially already get it. And I would like also to say that it's quite important to think about migration population in need of PrEP, because we are facing today that more or less HIV prevention in Europe being MSM-centered. So it's super easy, for example, for men who have sex with men who are sexually active, there is a high availability of different information through the peer-to-peer or whatsoever, where I can go to get the STI check and be prevented from HIV. But what if we are thinking about the migrant population who are coming from the countries where they also might have some HIV incidences and they have no access even to the information? Because, for example, even if I will go to a gynecologist, start talking about STI check, at least nobody will speak to me about this. and I'm not even talking about HIV prevention or whatsoever. But as we can see, it's highly important to understand that migrant populations, they are in need of of HIV prevention, PrEP, because half of the new HIV diagnoses being diagnosed already in European Union are coming from people who've been displaced, who've been moved to this country already. So it's let's say, let's think about me personally coming from Ukraine, and you already, from 2022, there have been a lot of millions of people migrated from Ukraine to all the European countries. There have been millions of people, mostly they've been women who might potentially live in with HIV or who never been diagnosed from HIV, but in Ukraine, there is HIV prevention doing quite great. I will show you later. But what I'm trying to point it out, that they have no access. There is no information where you can find where to go and how to get the HIV prevention. You might ask me, why do they need this? Because I would say that people coming to other countries, they might sometimes be involved in sex working, not only women, but men. Also, people coming just, let's say the majority of people came from Ukrainian where they were women. In context of HIV, they are mostly heterosexual women, but they might have no stable partner. They might live actual sexual life without even knowing about where I can be tested and where can I get the, for example, prevention. So let's have a look about how itself PrEP being built in Germany, as well as how the people coming to Germany might receive PrEP. So as you can see here, starting from the beginning, from 2015, with some fluctuation, but still the development of PrEP is doing really great. Each month there have been dozens of prescription of TDF, FTC. This is the only PrEP available in Germany, but it's not only about PrEP, but about TDF, FTC prescription nowadays. So around 40,000 people in Germany using PrEP, and 98% of them are only men who have sex with men. But however, as we can see the information from the Federal Ministry of Health, and today we've been hearing talk about this, that there are also other groups of people who might benefit a lot from the getting prevention. However, it's not easy for them to get any access to this. So here we can see again there is only oral PrEP being used in Germany. I would also like to point it out, for example, in our outpatient department, around 2,000 of people receiving PrEP. From them, 98% are being MSM and 93% are Germans. It's quite rare to see transgender individuals and women getting known about HIV prevention, and we have only 3 women getting PrEP, and they all are coming from Ukraine. So there is no other people being even informed about such a prevention. So let's see about the migration populations in Europe in general and in Germany. As you can see, in past 20 years, there have been a lot of people moving not only to Germany, but on the right side, you can see that Germany is being one of the top European destinations from people coming from this series of countries. And here we can see that Germany was always able to accept and help lots of migrants who are coming there. You can see 2 peaks on the slide in 2015, when lots of people were coming because of the Syrian war, and 2022, 2022 because of war in Ukraine. And if we will have a look how many migrants came to Germany just in year 2023, it's around 1,500,000. Who are they? 1 million of them are coming from Ukraine. 200,000 coming from Romania. On the third place, we see Turkey. Fourth place belongs to Polish people. And last but not least, Syrian people are still coming, and there is a lot of new people coming. So from now on, I would like to focus on these 5 groups of population coming to Germany, and I will show you how is it important also to understand how the HIV prevention is possible to get in their countries of origin, and how is it important to expand the understanding that there is not only men who have sex with men are in need of HIV prevention. So beginning from the Ukraine, being myself working back then in public health center, a Ministry of Health, and me and my team, we were really responsible for the implementation of PrEP around Ukraine. It started from a small project for 100 people in Kiev, in the capital of Ukraine, and up to 2022, more than almost 9,000 people were using PrEP already. As you can see there, nowadays, even despite the war, there's been a high interest in using PrEP. 23,000 of people using PrEP nowadays. And last year, injectable cabotegravir started as a HIV prevention in Ukraine. So, as I already mentioned, it started from a small project, and it's expanded. The project expanded itself for around 10,000 people. After 4 years of the beginning, 10,000 people were using PrEP. And even when we see that the war started in February 2022, there have been some fluctuation of people not being sure that they want to start PrEP. However, after this, there have been a real growth of people beginning the HIV prevention. So here we also can see that 74% of PrEP users in Ukraine are men. But if you can see what key population are in use of PrEP in Ukraine, there is only 42% identify themselves as men having sex with men. Second biggest group of people using HIV prevention in Ukraine is serodiscordant couples, because there are partners who want to be prevented when they have, for example, a partner being just diagnosed with HIV. So there is lots of women or men who take PrEP at least for first 6 months after their partners beginning the HIV treatment. And also third group of people are people who actively using injectable drugs. And in 2021, there is started also a project for a prescription PrEP in prisons, which allowed us to get a lot of people on a PrEP. But we also know that since the beginning of this year, there have been a lot of United States funding shifts. Unfortunately, it's horrible for all the African countries, but also Ukraine is going to suffer a lot from this. PEPFAR and Global Fund were always a biggest supporters and partners for the HIV epidemic in Ukraine. And nowadays we see that in Ukraine there's always available just TDF, FTC, dolutegravir and efavirenz for HIV treatment. And up to the beginning of March of 2025, there have been only stock of the treatment up to 6 months. And after this, because now the country itself, it's bringing lots of money towards because of the ongoing war situation, and there is not much possibility to invest the same money for HIV prevention and HIV treatment itself. And I would like also to mention that Ukraine is the biggest country who has the highest level of people living with HIV. So let's focus a bit about on a second group of people coming to Germany, to displace into Germany. This is Romania. Romania on a second place in Germany with a higher prevalence of HIV. And as we can see, there is lots of people getting injected by heterosexual way of transmission and also injectable drug users. However, till nowadays, there is no possibility in Romania get PrEP at all. There is officially saying that there is a 0 PrEP users. However, there are some people who well known about this due to work of NGO and etc. Unfortunately, they are in need of getting supplies via internet, which can bring us to fatal risks, such as, for example, renal toxicity, not quite great HIV testing, and also it might lead to drug resistance. Third group of country coming to Germany, it's people coming from Turkey. They have around the same situation with HIV as, for example, Romania and Ukraine itself. There is a lot of people which way of transmission is heterosexual and homosexual. Up to today, there is no official PrEP program. And 50% of PrEP users who are being informed, who are being receiving treatment in the country, they are purchasing the drugs over the internet or getting these drugs from their friends. The countries number 4 of people migrate to Germany are people coming from Poland. Poland is implementing PrEP quite great all over the country in big cities. There is around 18,000 of people receiving PrEP. However, PrEP, there is no reimbursement for PrEP, and people have to pay themselves for receiving the PrEP. And the last country I would like also to speak about is the people coming from Syria. It's, I would say, was quite difficult to find any information about situation with HIV in Syria, in HIV epidemic. And the official data showing on the year 2011, showing us that there is lots of people being transmitted HIV via heterosexual, homosexual and blood transfusion. Let's also do not forget that Syria is a highly religious country, and for example, people coming to us to get HIV prevention or treatment, it's quite difficult and challenging for them to even speak up about them living with HIV or them potentially having actual sexual life that they might be in need of PrEP, which also can bring us to a high level to HIV stigmatization and discrimination as well. So I would like to say that there are many possibilities in Europe and in Germany itself to get PrEP. However, the way for people displacing to the countries, it might be less challenging because these people might have easier access to get informed about the potential possibility of getting PrEP, also about easier possibility to being checked, and in case if they indeed in need of PrEP, it would be really great to just expand and the understanding that not only people who are having stable life, level life and whatsoever, they can easily get PrEP. So I would like to thank you for your attention.
Thank you very much.